Hi, Dr. Sasse here from the Continence Center and Nevada Surgical Associates. I was asked a question recently about Parkinson's disease and sacral neuromodulation when there's bowel or bladder incontinence, and what would make a person a good candidate for sacral neuromodulation to solve that problem if they have Parkinson's disease. We've had quite a bit of experience with this over the years. The condition of Parkinson's disease is one that has many manifestations, of course, and generally those manifestations have to do with the motor cortex, leading initially to two manifestations, which is tremor. That's the most common manifestation, and then a kind of a freezing type effect where there's immobility with respect to to movement. But there are also plenty of people who have bowel and bladder leakage or incontinence, and it may be in part related to Parkinson's disease. It may also be related just in part to the fact that those people tend to be a bit older, and they tend to be people who already may be in parallel developing pelvic floor dysfunction with bowel and bladder leakage. Regardless, what we have found is that sacral neuromodulation is the only real therapy that activates and restores the neurologic function of the pelvic floor. It is not acting in the same way as surgical slings and lifts and meshes, or in the way that medications might act to weaken or relax or tighten certain muscles. Instead, it's really activating the whole plexus of nerves that send signals to the pelvic floor and restore its normal action and function. So it would really make sense that sacral neuromodulation would be the best therapy for incontinence among people with a neurologic condition. And in fact, that's exactly what the literature shows. Strangely, when the FDA first approved sacral neuromodulation, the approval included some language that excluded people with neurologic conditions in many cases, which to us in the field makes absolutely no sense whatsoever, because it tended now to deny coverage for people who had Parkinson's disease, or who had had a stroke, or who had multiple sclerosis, from getting the very best treatment for what was an immensely frustrating problem of bowel or bladder incontinence. It's the treatment that works the best for neurologic conditions, and yet into this sort of approval language was written an exclusion for neurologic causes. It's very hard to understand the logic sometimes of committees who write things like that into these approvals, but what generally is the case is that they are very well intentioned, but that they did not specifically see data that addressed those conditions, and so it occurred to them to exclude it until there was formal data. Problem is that the way the world works is that there's really not enough money or incentive to formally study that subset of people and then resubmit and go through all the expensive and time-consuming process to have such exclusions lifted from the FDA or from Medicare guidelines. And so they tend to persist, and this happens in all kinds of areas of medicine. This is a particularly sad one because that exclusion really does hurt people, and it prevents people from getting the best treatment for bowel and bladder incontinence if they happen to have a neurologic cause or a neurologic condition associated. So bear that in mind, that you might be seeing a practitioner who says, oh, it's an exclusion under Medicare or FDA approval rules, and that's the background reason why. Nonetheless, the data shows, and our experience at a busy continence center confirms, that sacral neuromodulation is highly effective for people with just those conditions. And if you or your loved one has Parkinson's disease, or has had a stroke, or has multiple sclerosis, or other neurologic conditions, it should not deter you from seeking help and advice and seeing if this treatment would be the best for you. It's not always a guarantee that the insurance is going to, deny it or demand repayment because of that language in there. Often it is, true and unrelated to the bowel or bladder leakage condition. But what takes place with sacral neuromodulation is that this little chip device is placed kind of under the skin in the back pocket region with a lead that's traveling down into one of the sacral foramina, the little natural canals through the tailbone area. and it has a computer-generated fancy stimulus to the sacral plexus, which gives re-energizing, restoring, re-signaling to the pelvic floor musculature, so that we now have good signaling and good action of the bladder sphincters in the forward area and the bowel sphincters in the rear area. And this now restores control incontinence in 80 to 90% of people. It works extremely well, and it's especially helpful for people with Parkinson's disease and other neurologic conditions where other things don't work as well, and we don't have other good cards to play. So I hope that's been helpful in sort of framing the background in terms of the policy error that kind of lives on the books there, but also in terms of what we see in everyday practice in medicine at a busy continence center and what is in the published literature as well, showing that sacral neuromodulation is usually a very helpful treatment with very little downside and side effects and no invasive surgery or chronic medications. All right, I hope that's been helpful on this topic, and as always, I wish you the very best of health.